Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Hallie Leinhart, and I'll be your host today. Our webinar today is on understanding the cost of housing quality on families and communities. Housing quality is an important topic that has significant impact on the health, stability, and financial well-being, especially in historically under-resourced communities. Our panelists will present their research on how housing quality has changed over the last decades, how past discriminatory policies like redlining continue to shape the physical condition of homes and neighborhoods, and the lived experiences and behavioral aspects of housing. We are very pleased to welcome three distinguished panelists. First, we'll hear from Dr. Eric Hembry. He's the senior economist at the Federal Reserve Bank of Minneapolis. He will present work on housing quality improvements for low-income households since the 1980s. Eric, thank you for joining us today. Next, we'll turn to Dr. Christine Akenga, Roland's Assistant Professor of Environmental Health at Emory University. She will present her research on historical redlining and community-reported housing quality. Christine, it's great to have you with us. And finally, we'll hear from Dr. Stephen Schmidt, Assistant Professor of Sociology at Boston University. He will share his research on negotiating neglect and apartment disrepair in Los Angeles. Stephen, so glad you could join us today as well. Please note that views expressed by our speakers don't necessarily represent the opinions of the Institute for Research on Poverty or any other sponsor, including the University of Wisconsin-Madison. We have an hour today, and after we hear from each of our presenters, we'll spend the last 15 minutes or so for a live Q&A. You can type those questions in the Q&A box as opposed to the chat. Please do use the Q&A for your questions for panelists. We did get quite a few questions submitted as people registered, so we will be queuing some of those up as well. I hope that you'll also feel free to participate through the chat. We'd love to know who you are and where you're joining us from, so do feel free to put that in the chat box. And I want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. We will be posting the recording of the webinar within a day or so, and you will receive a link to those by email. So with that, I will turn it over to Eric.
Great. Thanks so much for having me, Hallie. I'm excited to be here presenting my work, and I went ahead and put a link to the full paper for anyone who's interested in the chat. So what I'll be presenting today is my work, A Rising Tide Lifts All Homes, Housing Quality Improvements for Low-Income Households since the 1980s. This is joint work with Michael Collins, who's at the University of Wisconsin-Madison, and Sam Wild, who is at the University of Illinois, Chicago. As Hallie said, I am an economist here at the Community and Development and Engagement section at the Federal Reserve Bank of Minneapolis. As such, I need to give my disclaimer as well that these are only my views, not those of the Minneapolis Federal Reserve or the broader Federal Reserve System. This paper also receives some funding from the Social Security Administration. This is their much longer disclaimer, but basically says it doesn't represent their views either. Okay, so the very basic question that this paper is going after is trying to understand how has housing quality and quantity or overall housing consumption changed for low-income households since the 1980s. And we think this is a really important and interesting question for, I think, two primary reasons. One is that, when I started this project and I was really thinking about it, if I just had to pick one good to try and measure, well-being or consumption, it would be housing. It is the largest aspect of most households' budgets. Somewhere between 30 to 50% of the average household budget is going to be spent on housing or housing services. No one is going to disagree that it's an absolute necessity for households, and as such, lower income households spend a larger fraction of their budget on housing than higher income households. And so it's particularly relevant and important for understanding consumption and well-being for lower income households. And we just, we spend so much time there, so much effort there that I think we all could agree that it's just a very important good. And I think that there's a little bit of an outstanding question on how this has changed over time. Are we, on average, living in bigger, more spacious, more higher quality housing units, or are we living in kind of smaller, more cramped, worse quality housing units? And is there a difference in that across the income distribution over time? Okay, so I think there's this, it's important, it's a big question. And then lastly, the big research addition here is really trying to measure the quality part, because this is much tougher than you would imagine. Other papers that try and look at this measure maybe just the number of bedrooms and bathrooms in a house over time, or the home ownership rates, but those don't really capture housing quality very much. And any of us who've tried to rent a house on the market, even if it has kind of, same 2-bedroom, 1-bathroom setup, you'll notice a wide variation in prices even within the same market. And a lot of that reflects the underlying quality of the unit. And so it's this very important thing, but that can be tough to capture in survey data or understand these big aggregate trends over time. And so to do that, we're going to use the American Housing Survey. This is really kind of the ideal survey to get at our research question. It's been fielded every other year from 1985 through 2021. It's nationally representative. It has about 60,000 observations per survey. It has really detailed, or at least the most detailed characteristics on housing quality of any national survey that we have. It also has a lot of information on housing expenses and income, and it has other housing attributes as well, such as number of people, their age distribution, their marital status, that sort of thing about the household. We were particularly interested in focusing on lower income households here. We define lower income in 2 separate ways and present those results side by side. Ultimately, we find that trends are pretty similar across these 2 groups, but one way to measure it is people who report receiving benefits from the social safety nets. This can include supplemental security income, TANF or AFDC income, or receiving SNAP or food stamp benefits. And then an alternative way is that we group everyone in the bottom 20% of the income distribution for each year. And so these are 2 ways of kind of trying to get at a similar group of people, just lower income households over time. As I mentioned, our biggest focus on this paper contribution is trying to measure housing quality. And I want to be clear that what we can actually observe in the data is what I would call measures of poor quality. So we are able to track 35 indicators of poor quality consistently over our time period here. We're going to create binary measures for each of the 35. So these are 0, 1, where 1 always indicates presence of this poor quality measure. And you'll see a couple examples in a second, but again, you want to think of these as all basically representing poor quality things. And what we don't have, and what I haven't seen in many other data sets, are measures of what you might think of as medium or high quality aspects of housing. We're not going to be able to see whether you have a granite countertop or a bidet in the bathroom, right? No high-end features. These are all pretty low quality aspects of housing. We've categorized these into kind of 4 basic groups. We can measure things about the exterior features of homes, such as the quality of the roof, if it's sagging or has a hole in it, whether there are visible external water leaks. There are interior features of the home, such as, are there presence of rodents in the house? Are there peeling paints on the walls? Are there holes in the floor? We have a number of indicators about the presence and working condition of appliances, plumbing, and electrical issues, such as if there's been sewage breakdowns or blown fuses, or the presence and working condition of a dishwasher, or if there's no running water in the house. And then lastly, we have a couple, not a lot, but a couple measures of neighborhood quality. These include whether there are bars on windows nearby in the neighborhood, whether there's visible trash or litter nearby. And then there's also a self-reported neighborhood quality variable as well that we use. Okay. So we have a lot of these variables. We have 35. We want to find a nice aggregate way to represent and discuss them. So we create a poor quality index, or PQI. So what you want to think about us doing for this is we take all 35 measures, we just add them together. Again, these are all 0, 1 measures. So we do an addition, but we do this z-scoring to each variable, which you just want to think about as we're adjusting it so every single one of the 35 measures has equal weight within there. So whether a measure is observed more or less often doesn't end up impacting kind of how much it can move the PQI index. So keeping in mind that a higher value here is going to mean that a home is of worse quality. What you would be hoping for is that the value of PQI goes down over time. That would reflect increasing housing quality. We talk about poor quality in kind of a couple ways. One way we do that is we create a measure that we just call whether it is a poor quality home or not, and that is the kind of the 10% worse homes in terms of quality that we observe over the entire sample period. So if I say a home is a poor quality, that's our definition there. And then we'll call a home of good quality if it doesn't report a positive value for any of our 35 indicators. Those are kind of the two ways that we break up the PQI, in addition to just talking about an average value. Yeah. We also measure housing quantity. So this is kind of the size and the shape of the home. These include, number of maybe basic measures you would think about. We have square footage and the lot size. We have number of bedrooms and bathrooms. And then we have a number of additional features as well, such as whether there's a basement, central heating, whether there's a porch, whether there's a garage, kind of those measures as well. All right, so this is kind of our first big summary measure of looking at trends over time. If you look at the panel on the left, this is the rate of poor quality housing among low-income households. The blue line is always going to represent that social safety net group. The red line is representing the bottom 20% of the income distribution group. That'll be consistent across our figures here. And so what you'll see is a really pretty strong and steady decline in the rate of poor quality housing from 1985 to 2021. Over this period, the rate of poor quality housing has declined by over 50% among this group, whereas in 2021, we're at about 10 to 15% of homes occupied by low-income households we would qualify as poor quality housing. If you shift to the middle panel, you can see that we saw a smaller in percentage term, but still positive increase in this quantity measure of square footage per person in the home. So that's up about 20% over this 35-year period. And then lastly, for some context as well, we're showing how average housing expenditures has changed over time. These are inflation adjusted dollars, and you can see on average, we went from in 1985 among our groups spending about $600 a month to by 2021, it's almost at $1,100 a month. So really a large decline in poor quality housing, a modest increase in the size of that housing, and a pretty sizable increase in how much we're spending on housing as well for low-income households. To really drill down and focus on the poor quality aspect, this is at least one way I'd like to visualize the improvement in poor quality over time. So this is showing you the entire distribution of home quality across the entire nation, not just low-income households, in 1985, just that 1 year. Okay, and so the black line here is showing you the average home quality in 1985. The red and the blue line show you the average among our two groups, among bottom 20% and social safety net recipients. So you can see that they're at about the 85th to 90th percentile on average, pretty far below the average housing quality across the entire 1985 distribution. And then what I'm going to do is I'm going to look at the average value for these people as well in 2021 and put it back in the 1985 distribution. So we want to see, how much among this group of low-income households did they move within this distribution of 1985 homes. And that's what these two dotted lines are showing you here. If you have a statistics degree, what I would tell you is this increase is about a full standard deviation from 1985 to 2021 among this group, which is pretty substantial. If you don't have a statistics degree, that's perfectly fine. The way that I would also think about it is, again, you went from on average in 1985 being among kind of the bottom 10% worst homes in the country to by 2021 being close to where the average national home was in 1985. So again, I think that's a pretty nice reflection of just how large the increases in housing quality were. The other way that I'd like to show how housing quality improved is show you for every single measure, if we take all 35, how did it change from the beginning of the period to the end? So I'm going to show you here a scatter plot. If it's right at this dotted line at 1, that means that the value didn't change at all. And the further down it goes, that means the larger reduction in occurrence of poor quality it is. And so what you're going to see here is that for every single one of our 35 measures, it improved by 2021. So it was a really broad increase. Again, every single one of the 35 things we're measuring improved. And on average, it was a pretty large decline. So the average decline is 50%. If we switch over to looking at kind of the size of the home or the quantity of the home, things flip a little bit. So instead of seeing all negative values, now we see all positive values. So all of the 11 different ways we measure kind of size and shape of the home, those all increased over time, although the size of this increase is a little smaller. Okay, and then the last kind of statistical exercise we do here to understand and kind of translate these gains is we run what's called a hedonic pricing model on the 1985 data that we have, and then we project forward what we think units would have rented in future years if they were back in the 1985 market. And so again, the way that you might want to think about this is, all right, if we look at somebody's home in 2021, what do we think that would have rented for in 1985, and how much of an increase in the value of that home do we see? And we do this kind of separately for the rental market and the home purchase market. Here are two columns are either for social safety net recipients or the bottom 20% of the income distribution. Kind of similar stories here, so I'll just focus on one of these to help capture what's going on. If you look at the bottom right panel here, this is looking at rental values for the bottom 20% of the income distribution. What this is telling you is that in 1985, on average, their homes rented for $600 a month. If you and that's what the black dotted line shows you throughout this whole period. By 2021, if you just looked at the characteristics of the home, that had now increased to $800 per month. So overall, this was an increase of something like 33 to 40% in the value of the home based on these observable characteristics we see, with about half that gain coming from quality and half the gain from quantity. I know that I'm about up in time, so my real quick wrap up is overall, we saw housing consumption increase pretty substantially among this group. A very large and broad increase in housing quality, a moderate increase in the size of the home, but we also saw housing expenditures up a fair amount, although a lot of that is due to the fact that incomes were up along with it. So we didn't see the budget share spent on housing go up a lot, even though we saw the total amount of money spent on housing went up. So with that, I'll go ahead and stop and turn it over to Christine.
Thanks, Eric. I'm hoping that my screen is shared. If I could get a confirmation.
Looks great.
Great. So I just want to thank everyone and the IRP for this invitation. My name is Christine Ikenga. I'm an assistant professor of environmental health at the Rollins School of Public Health at Emory. And so I studied a relationship between environment, and in this case, neighborhood housing and health. So first, I wanted to introduce everyone to the social determinants of health and why we're focusing on housing. And so the social determinants of health, these are non-clinical conditions that can shape your everyday exposures and opportunities, which can in turn influence health outcomes. The US HHS, Health and Human Services, they've kind of grouped these determinants to 5 domains that you can see here on the right. And because these factors, they are outside the clinic or hospital, these are modifiable factors. So in terms of addressing health and thinking about effective solutions, these are factors you can probably tell here that will require kind of multi-sector action for those of us in public health, those who are working in housing or transportation, planning, education, community groups, so on. What I'm interested in, as I mentioned earlier, is the neighborhood environment. And the neighborhood environment refers to kind of the physical features of a place that can affect health and safety. So these are components that include environmental conditions like air quality and water quality and heat, in addition to, housing costs and housing quality, which is the focus of this talk. So I wanted to introduce this framework. It's kind of the housing pillar framework, and it's a framework that was developed by a colleague, Diana Hernandez at Columbia, and she uses this to kind of explain how housing shapes health. And these are kind of 3 pillars that can predict health outcomes. So first, I wanted to start with affordability. Affordability is not just about paying the rent. It's about whether a family can cover housing and still meet their basic needs. And what happens here with affordability, when your housing bills, your utility bills, when they eat up too much of your income, people tend to make really harmful trade-offs. So these trade-offs can include skipping medication, delaying clinical visits, maybe cutting food. And these are trade-offs that can lead to poor health outcomes. So affordability kind of links to the next pillar, which is security. And what I mean by security is whether people can stay housed stably or meaning stability. So we're thinking about eviction, foreclosures, sudden rent hikes, maybe disasters, anything that can push families into frequent moves or homelessness. And this type of housing instability, it can disrupt your access to healthcare, your care itself, maybe your medication use, which again can disrupt health. The third pillar is suitability, which is it's kind of referring to like your housing quality, housing safety. Is your home healthy and safe? And so we're concerned here about environmental hazards, mold, pests and allergens, maybe poor ventilation, temperature extremes. These are conditions that, as a public health scientist, I'm concerned about because these are fixable. They're modifiable, and I think that they can play a role in terms of thinking about neighborhood or housing level interventions that can improve health. So I wanted to show this figure here because history is really important when you're thinking about housing. In the United States, I think we're aware that housing hasn't been fair for everyone. These are problems that did not happen by accident. For many years, there were policies and practices that made it easier for some people to get good homes in safe neighborhoods and harder for others. Go back to the last century, from the early 1900s to the 60s, there were many policies and practices that kind of forced people to live apart. You had neighborhoods that used restrictive covenants. These were rules that said that your home couldn't be sold or rented to a non-white family. Maybe there were real estate agents who steered families away from certain areas. At the same time, you had towns that passed zoning rules that allowed maybe for only single family homes or block apartments. So you're keeping cheaper housing out of wealthier areas. And so altogether, these actions, these policies, they can introduce more money into some neighborhoods and starve others. By the middle of the 20th century here, after World War II, then you have the government who's really helping to build your suburbs with, highways, new highways and easy loans. And you have people who are moving out of cities. They're moving out of cities, they're taking their money and their wealth with them. And in cities, you have these urban renewal projects that are tearing down neighborhoods that are considered blighted. And when you tear down these neighborhoods, you have residents who are pushed out and are not really given really good or quality replacement homes. So I share that history, and I think, we're aware that we're still seeing some of these gaps in terms of housing and wealth today. We can see it in lending and in the rental market. We have rising rents, rising levels of evictions. We have investors who are buying up properties and pushing people out of their neighborhoods. And so we're seeing these gaps in neighborhood home ownership and home value and potentially quality today. So I think that looking at history can help us understand what's happening today, and it can help us make better choices and think about better policies. So one of the policies that I was interested in this work was policy of historic redlining. And so redlining, it was a policy from the 1930s where there was a federal agency, the Homeowners Loan Corporation. They created these maps for cities across the U.S. where they graded neighborhoods. And they would grade the neighborhoods from A, which are best quality neighborhoods, to D, which are poor quality neighborhoods. And the neighborhoods that were graded D, they were colored red. And these were neighborhoods that were more likely to have Black residents, immigrants, maybe have older, lower value homes. And based on the grading of these neighborhoods from A, which were here in green, to red, who were considered D labeled neighborhoods. Based on these grades, mortgage lending, insurance, they could be steered away from certain neighborhoods, in this case, the red neighborhoods, and steered more towards more desirable neighborhoods. In this case, on this map, more of the green and the blue neighborhoods. So we wanted to think about what a practice like that, what are the implications for a practice like that today? And so with that in mind, our research question, our study asked, do places that were redlined nearly a century ago, do they show more housing quality problems today? And what we did was a spatial analysis of resident reported housing complaints here in the city of Atlanta. And we had a couple of hypotheses. First, we thought that the redline neighborhoods would have higher rates of these complaints. And we thought that we would still see this association between redlining almost a century ago and housing quality today, even after we adjusted for some current day characteristics of our neighborhoods. And what we did was we made a data request to the city of Atlanta, and we received a file of 5 years worth of housing complaint data. And I have some really talented students and staff who went through and cleaned this data. So you can see some examples of some of the reported complaints on the right today. And when we mapped them, we saw there was evidence of like really significant clustering of these complaints. We grouped first of all, we looked at all the complaints, so all 49,000, and then we looked at complaints that were considered like hazardous to health. So complaints maybe about chemical spills, like flooding or sewage, or heat or water complaints. And even with those hazardous complaints, we could see the clustering of complaints. So we used a spatial statistics to kind of identify where the hotspots were in Atlanta. And we found that the hotspots, areas where you would see a greater number of these complaints, particularly hazardous complaints, were in South and West Atlanta. And these were areas where there were redlining, so the D or the red labeled areas. The cold spots were more likely to be in North Atlanta, and they overlapped with the graded neighborhoods. So our takeaway here was that this historical disinvestment, this redlining from almost a century ago, it leaves an imprint on today's housing quality. And we saw that the complaints, they captured like real hazards, lack of heat, that can affect safety and health. And even after we adjusted for the current day neighborhood characteristics like demographics and poverty, we still saw an association between historic redlining and these housing complaints. So what does this mean in terms of policy? What should we do with this data? Well, we've had a couple of ideas in meeting with our community partners, and we think that we can use this data to target inspections. We think the city can use this data to target inspections and healthy home repairs, maybe landlord and tenant outreach. Because we know that all of these factors are associated, these social determinants, maybe we could pair our enforcement with other supports, legal aid, food aid, so that our low-income tenants are not feeling the burden of dealing with addressing these issues. As a public health researcher, I'm using this data to look at health outcomes, neighborhood level health outcomes, and what potential interventions could mean. So for example, we have data on time of reporting, time to resolution. We are modeling whether time to resolution would be associated with hospital admissions, asthma rates in the neighborhood. Could we model an intervention where we can intervene at the housing level to improve neighborhood health? And finally, I think what this study shows is that we need to invest in these neighborhoods that have been historically redlined, historical disinvestment, and think about ways that we can reduce vacancies and protect renters. So I want to thank my fantastic team, the students and staff who have worked on this project, and my community partners for their valuable input. I welcome new collaborations. We're really interested in expanding this work to other cities and thinking about ways where we can drive action. And so that I'm looking forward to the questions and the discussion, and I will now toss it to Stephen.
Okay. Hi, everyone. Such a pleasure to join you all here today. Thank you to the IRP for the invitation, and thank you to all of you for taking some time out of your day to come hear us chat about housing quality. So my name's Stephen Schmidt. I'm an assistant professor in the Department of Sociology at Boston University. And today I'm going to be presenting some research from fieldwork that I've done with renter families in Los Angeles who are on the ground dealing with some of these housing issues. So before I jump into that, though, I wanted to just give you a sense of where this work that I'm doing and that others are doing kind of fits into past research. So as we know, right, as Christine laid out really nicely, the homes and neighborhoods where we live really play a huge role in our well-being and shaping our life chances. And because of that connection, social scientists have really focused on mobility processes, right? So how families arrive at particular neighborhoods, how families come to live in certain types of living arrangements and homes, why families might have to move, are they being displaced, experience eviction, but this focus is on mobility. And we, as a result, just know a little less about families' experiences in their actual homes. And this is sort of where this housing quality piece comes in. And I think this is particularly important to study because mobility is harder and harder to achieve. So what I've tried to lay out on this slide is what we all are living through right now, which is just a really heavily constrained rental market, right? So housing cost burdens are extremely high, vacancy rates are low, we're experiencing a national shortfall of affordable units. So all of these things make it harder to move. And we see this play out in mobility rates writ large. So here I've used AHS data to plot the share of renter families who've moved during the previous 2 years across in their income category, essentially. So two big takeaways here I just want to highlight. First, that mobility rates are trending down across groups, but also that our higher income earners are actually moving kind of at higher rates than our lower income families. So there's some evidence that lower income families may be more hesitant or unable to move in this constrained rental market. So in this context, right, where it's really challenging to move, a renter family might be adopting trade-offs to avoid unwanted moves. And so in my study, in my project, I look at one such trade-off around maintenance issues. So I examine how renters in Los Angeles manage unit quality failures in order to avoid an unwanted move in a really constrained rental market. And to show how this plays out, I use in-depth interviews with the 131 families with kids who I interviewed. I interviewed families in Los Angeles in 3 neighborhoods, and I interviewed 3 main groups of people, 4 main groups of people, middle-income Latino families, middle-income white families, low-income Latino families, and low-income white families, all of whom rent. And what I found, right, is that low-income renters are really frequently experiencing maintenance problems at home, but because of rental market constraints, they're quite hesitant to initiate another housing search. So instead, families are left investing a lot of time and resources into a process that I call negotiating neglect. I find further that these maintenance issues are predominantly endured by low-income Latino immigrant households in particular. And kind of on the flip side, middle-income families across race ethnicity tend to report a lot faster repairs, or facing conditions of chronic disinvestment, they make plans to leave, which limits the amount of time they spend negotiating neglect. So to speak to this first finding, right, maintenance problems are frequently endured. I use California's implied warranty of habitability, which is just a law that lays out which repairs are the responsibility of a landlord to categorize sort of the frequency of maintenance issues across the sample. And I find 38% of low-income white families report a current problem, a maintenance delay, or a self-repair, relative to about 64% of low-income Latino families. And despite experiencing these issues, renters are really hesitant to move. So for instance, I spoke with Adela, who was managing a broken hot water heater, faulty wiring in her home. And she told me about a time even when her living room ceiling collapsed in from a plumbing issue from upstairs. She says, people ask me, how do you put up with that woman, her landlord? I tell them, because I can't live somewhere else. It has been very, very difficult and frustrating, but rents are high. You have to put up with where you're living because you tell yourself, where would I go? No one will rent to me. So here she's highlighting how the lack of housing options have really kept her in her home despite disinvested conditions. So rather than move, low-income families manage apartment disrepair. And in the paper, I pull out kind of several different dimensions of this process. So the first has to do with trying to forecast or predict how landlords respond to repair requests or to potential city enforcement. The second, renters engage in like a really time-consuming, tedious process of following up about partial repairs or non-response. Some families who are frustrated take repairs into their own hands. And then finally, other families are just left managing kind of the consequences of disrepair. So they're not able to get repairs. They can't afford to repair things themselves. So they're left managing kind of the fallout of living in an apartment with a lot of problems. So to illustrate this, right, Alma has a kind of a nice vignette around forecasting landlord responses around city enforcement. So she has decided to report a lot of housing issues to her landlord, but she won't take that next step. She says, if the landlord sees something's broken, she pretends like it isn't there. I've been telling her about the wiring since I moved in. The issue with the cockroaches is a problem that we have every day. But nonetheless, she says she doesn't want to call on the city to file a complaint. She says, if I report it to the city, it will become a fight with the owner. She'll be looking for any little thing to kick me out. That's something I want to avoid for my family. So here, Alma really hesitant she's trying to predict and forecast what the response will be. really kind of the modal experience in the sample is this really long process of following up around delayed repairs. So Marta, for instance, she says, there's a hole in the floor in my bedroom. I've been complaining about it since I moved in. They put cement right away, and that's the only thing they fixed that day, and they still haven't come back and fixed it. There's no flooring there. So it takes literally forever to come and repair things. So throughout Martha's 4-year housing tenure, she has always been in this extended back and forth with her property manager about her ceiling, excuse me, her floor, pest infestations, leaks, and other issues that haven't been resolved. Finally, some renters, want to live in dignified spaces that meet their family's needs. They end up investing a lot of their own resources into repairing their unit. So Cynthia describes this process. She says that her husband started to put money into the apartment. He changed out the flooring, the carpet, the window screens, the door, but we paid for it because the owner wouldn't fix anything. We put down flooring, outlets, a stove, air conditioning. Little by little, we changed it all. So really a substantial amount of resources that this is a pretty common experience. Families invest a lot of money into fixing up their own units. And then finally, some families, are left enduring disrepair. So for instance, Evelyn says, I hate this place. I never say the word hate, but I can't sleep. I feel anxious. I'm constantly like, I don't want anything to get broken because I don't want to fix it. And if they fix it however they want. It's really stressful for me. So here kind of highlighting how these chronic disrepair, chronic disattention turns into chronic stress. And then just to wrap up with the middle income families, so the upshot here is that these issues are less frequent across middle income households, across race, ethnicity, and that middle income renters, when they do encounter persistent conditions of disrepair, they make plans to leave, right? So for instance, Levi told me that a pipe had burst in his apartment and his landlord refused to cover the costs of deep cleaning the sewage leak, and that he and his wife were searching every day and night for a new home, and that they had already identified several feasible options nearby. So we can contrast Levi with Adela, who I introduced earlier. They're neighbors. They live a few minutes down the road from each other. They're both experiencing these conditions of disrepair, but Levi is able to plan a move, whereas Adela feels that she's stuck in place. Okay, I just want to conclude really quickly with a couple of implications. So the first for researchers is I think that we often assume that just because a family is not experiencing displacement, that they're doing well, right? And I think what this work shows is that the absence of displacement really doesn't necessarily mean that there aren't harms occurring. And then for housing policy and practitioners, I think we can think about ways that housing inspections should be proactive and prioritize coverage. So a lot of housing complaint systems tend to be, housing inspection systems tend to be complaint driven, which means that you as a tenant need to call up the housing department and file a complaint. Tenants are fearful of landlord retaliation. There's some promising research that shows that proactive inspections can help mitigate some of these retaliatory practices. That said, the system in LA is proactive, right? And we still see these issues. So I think we also could think about broadening inspection coverage. So for instance, in Los Angeles, inspections often occur during business hours when tenants aren't home. They occur once every 4 years. So there's ways that we can think about getting better coverage for housing inspections when they do occur. And I just wanted to plug really quickly. So I presented work from tenants' perspectives, but if you're interested, there's 2 really wonderful qualitative books on this issue, Collateral Damages, which explores this from the landlord perspective, as well as Stacked Decks by Robin Bartram, which looks at this from the perspective of building inspectors. Both really great and kind of give us a holistic understanding of how this code enforcement system works. So with that, thank you so much, and I'll go ahead and stop sharing.
thank you so much to all of our panelists, Stephen, Christine, and Eric. That was great information. I want to jump right into some Q&A. We had a lot of questions coming in, and I have several that are queued up. I'm going to start with one that it was a reoccurring question that I received, and it's around the disparities that we might be able to see between rural, suburban, and urban areas. I would like to start with you, Eric, on this question, if you were able to see any of that, or I know you were looking at a broad category, but if you can speak to the differences that we might see across areas of rural, suburban, urban.
Yeah. So I have some limited ability in what I could do related to separating out by geography type. But what I would say is that it's not in the paper because you can do a lot of stuff, but only a bit makes it into the final cut. But part of the reason it's not there, a breakout of say trends differentially by type, is that it didn't seem particularly interesting and that we saw roughly similar increases across urban, suburban, and rural types. But that would be the basic takeaway, is we didn't necessarily see one as jumping out as being particularly strong or weak across geography type.
I'd like to ask Christine or Stephen, starting with you, Christine, if you have any insights into that question.
So, my study focused on urban Atlanta, and one of the caveats of our results is, we are relying on community reports, and we know that there are some groups who may or may not be more likely to report these issues, as Stephen discussed. So it's actually a question that we're looking to pursue. This is an urban, relatively to the rest of the US, higher income area, an urban area. Will we see these same reporting patterns in rural and suburban areas? We don't know, but these are our considerations for future work.
Yeah, I would say that's a wonderful question. I don't really know too much about rural areas in particular, but I think that we can think about the ways that rural areas as just being generally under-resourced in many ways, how that might translate to things like building inspection regimes, right? If coverage isn't great in Los Angeles, right? What about kind of more rural parts of California? My prior there would be that it wouldn't be much better. And I wanted to plug maybe the Joint Center for Housing Studies at Harvard, I think has collated some more research on like housing quality issues in rural areas. And so I think that could be a good place to look for some emerging research on that topic.
Excellent, thank you. I'm familiar with that center as well, and we can always link to that. I would like to turn to an issue that I'll pose this to Stephen, just because I think this might be something you might know a bit about, given where your study took place. But then I'll pass it along as well. Is there any research, or do you have any insight into how housing quality or disrepair, due to the impact of weather conditions such as wildfires or flooding or high winds, etc.? What ways this has impacted people's housing quality, and especially maybe renters or those who need to purchase protections for their homes that they own. How can people navigate this? I know it's very complicated and an often very expensive issue, but do we have research about how this is really impacting people. And I'm actually thinking, so Stephen, go ahead and answer, but I know Christine actually has a significant background in this.
Yeah, I think like one thing that comes to mind is research. I don't know too much about this topic, so apologies that I'm keep pointing you to other research directions instead of being able to talk about it directly. But I think there's a lot of really good work on insurance markets and home insurance in Florida and kind of how insurance markets are responding to increased climate risk and there's translations for that research in California with wildfire and kind of how insurance markets are responding to to that. And so in terms of like how that impacts recovery processes for like groups like renters, I'm not as certain. There is some work on like the recent LA wildfire, some of those communities were had a large share of renters, the Eaton fire in particular, and I think there's conversations around like tenant protections for families who are out of work because their, employment went down during the wildfire. So, but in terms of like specific research studies, I don't know. I can direct you much more beyond that, but maybe Christine, if you want to take a stab at that one.
We do know, so it's very interesting. Several of the complaints in that large data set were complaints related to urban flooding, which is kind of an extreme weather, kind of potentially climate related environmental exposure. And what we do know is that these issues can lead to increase for adverse health effects, both mental and physical health impacts. Those who are most at risk, most vulnerable are those who we traditionally see as at most risk and vulnerable. So children, older adults, and of course, renters as well. So it's not a stretch to suspect that these kind of climate related events will have impact on housing quality, regardless of your socioeconomic status or background. But some of our most impacted will be those who are low income and don't have as stable housing as others.
Thank you. I received a question in the Q&A box that I think is interesting. So this participant said in Pennsylvania where they live, tenants have a right to repair under the implied warranty of habitability. This means that landlords must fix serious issues affecting habitability and safety. If a landlord fails to act within a reasonable time after proper notification, a tenant may be able to withhold rent or use a repair and deduct remedy to cover the cost of repairs. So they're asking, does this panel think that having this type of law in other states would be helpful? Are there other examples of ways that tenants can improve their outcomes or have more kind of agency or ability to seek repairs in this way? Stephen, I'll go to you as I know you might have some input, and then maybe the other panelists.
Yeah, that's such a great question. I think like those programs do hold a lot of promise. So in Los Angeles, there's something similar, like a rental escrow program, right? That if a landlord fails to meet habitability standards consistently, their tenants pay rent into an escrow account to court until all of those violations are resolved. So that sounds like another kind of iteration potentially. Jackie, of the Pennsylvania program. I will say that there are a lot of challenges around that. Like, it's very complicated for tenants. Like, they don't have, it's difficult to understand. Sometimes, like, I think tenants in general are so risk averse, right? That you really have a hard time, especially when your alternatives are so limited. And it's your home right on the line. Tenants really are not it's a time-intensive process that can be confusing and also comes with legal risks, right? Like if you don't go about it the right way in Los Angeles, and say you don't pay your rent, right? You withhold your rent in order to induce a repair. That is a cause for eviction in Los Angeles. So tenants actually, in my study, had done that before and then found themselves evicted. So I think, you know, we I think pairing a policy like that along with some kind of like right to counsel for tenants, right, that gives them sort of legal protection as they pursue that, could be a good step forward there.
Yeah, and maybe I'd add I mean I haven't studied that policy particular, but I've certainly seen research on kind of effects of a wide swath of renter protections in general. I think it's good to keep in mind, as with all these policies, there's often some trade-offs that are happening. So having a right to repair can give some more kind of agency or power to renters to get things repaired. But there's also plenty of evidence that shows that, you know, it's not necessarily going to be free. It's going to kind of raise general rent levels as well if you're requiring more of landlords to do upkeep. That might be a fine trade-off, but it's just good to keep in mind too that as you add more renter protections, often we see an association with rents going up as well too. So it's just another aspect to keep in mind.
Christine, anything to add on that? So I wanted to, I think we have time for at least one more question, and I'm interested to hear from each of you. People are always very interested in great examples or solutions that they can turn to. So do you have any examples of different solutions that you've come across, or any great case studies that you can hold up that would offer some ideas for people working in this space with tenants or with homeowners? Christine, I'd like to go to you first.
Yeah, I shared the results of this study with several community partners, and they found it, well, unfortunately, the results weren't surprising to them, but you know, especially with some of the mapping we did, what I gathered from their feedback is that this could be a potentially useful tool in terms for them for advocacy. Um, you know, we've identified some hotspot areas that can inform, you know, future interventions. And it can also, in their opinion, they think that, you know, this kind of data can help identify kind of bad actor landlords. But there was also concern, particularly for some of the more, you know, vulnerable residents, and even some homeowners that are property owners as well, is that this sort of information, this kind of community reporting mechanism could be used to kind of target them as well. So the feedback mostly positive, but there is a little bit of caution. But in general, they think that we could this sort of you know, collating, mapping, it's pretty useful for identifying priority areas and targets for intervention.
Stephen, and then Eric.
Yeah, I think I agree with Christine, and I'll just add too that maybe we can think about other models of housing delivery that exist without a little bit away from like private market mechanisms, right? So we can think about things like social housing, public housing, community land trusts, things that sort of divorce housing provision from like some of this cash flow calculus of landlords that often leads to disinvestment. I think Meredith Grief's book is a really good place to look for answers around that. And I'll leave it there so we have time for Eric.
Thanks. So I won't quite point to a specific policy, but I guess I'd connect it a little bit in two ways for big policy takeaways on our paper. One would be that, you know, a lot of the consumption gains, the quality and quantity gains we're seeing in housing is reflective of increased income that we're seeing among this group. And so a lot of this just general improvement in material well-being seems related to the fact that we've been able to boost incomes of these households over this time. So we want to see continued gains. Continuing to find income improvements for them is going to help do that as well. The related aspect, I guess, in terms of housing policy would be what we're finding is consistent with a model of housing called a filtering model, where generally when new housing comes online, you see that kind of generally filter through the population, and older housing kind of gets discarded once it becomes kind of vacant and older. And so policies that could allow for more building of newer homes, even though those generally go towards higher income households, will often suggest that, even though maybe lower income households aren't moving into new homes, they will still be benefiting from allowing more production of new homes, because it allows kind of higher quality homes to be available for them.
Excellent. Thank you all so much. And we'll end it there. Thanks so much to Eric Embry, Christina Kenga, and Stephen Schmidt for sharing their time, experience, and research with us today. And thank you to Don Duran for handling the tech for the webinar. Just a reminder that we will be posting the recording of the webinar along with slides within a day or two, and you'll receive a link if you did register for the webinar. And with that, thank you all for joining us, and have a great rest of your day.
Thanks, everyone.